How do I compare Medicare Advantage plan deductibles effectively? Imagine trying to pick the best health plan without knowing what you'll pay out of pocket. It's like shopping for a car without knowing the price. Today, we're going to make that process easier. Let's break down how to compare Medicare Advantage plan deductibles so you can choose what fits your needs and budget. First, understand that Medicare Advantage plans, also called Part C, have different deductibles from plan to plan. Unlike original Medicare, which has set deductibles each year, these plans can set their own. For example, in 2025, the Medicare Part B deductible is set at $257. But Medicare Advantage plans might have their own separate deductibles for medical services and prescription drugs. Some plans only have deductibles for Part B services, while others include drug coverage as well. It's important to check each plan's details because they can vary quite a bit. When comparing plans, look at two main types of deductibles. The first is the medical deductible, which is the amount you pay out of pocket before your plan starts covering your doctor visits, tests, or hospital stays. The second is the prescription drug deductible, which is what you pay before your plan begins to cover your medications. Some plans combine these into one deductible, while others keep them separate. Knowing this helps you estimate your total costs better. Another key factor is the out-of-pocket maximum. This is the most you will pay in a year for covered services. In 2025, the maximum in-network out-of-pocket limit is $9,350. Once you hit this amount, your plan covers all additional costs for the rest of the year. Comparing these limits helps you understand your worst-case scenario. To compare plans effectively, start by listing your healthcare needs. Think about the services and medications you used last year and how often. Then, gather the deductible information for each plan you're considering. Check if deductibles are higher for out-of-network care because some plans charge more for services outside their network. Use Medicare's Plan Finder tool on Medicare.gov to see how your specific medications will cost under each plan. Enter your drugs and preferred pharmacies to get accurate estimates. Look at the total costs, not just the deductibles. A plan with a higher deductible might have lower copayments or coinsurance, which could save you money overall. Conversely, a plan with no deductible might have higher copayments for each visit. Think about your healthcare habits and choose what makes the most sense for your budget. Remember, deductibles are just one part of the picture. Many Medicare Advantage plans also include benefits like dental, vision, and hearing coverage, which can add to your total expenses. Also, check the plan's star ratings, which show quality and performance. Confirm that your preferred doctors and hospitals are in the plan's network because out-of-network care usually costs more and might have higher deductibles. Use comparison tools like the Medicare.gov Plan Finder or insurance company websites. These tools let you compare deductibles, premiums, copayments, and out-of-pocket limits side by side. Be sure to note whether costs are for in-network services only or if out-of-network options are included, as this can change your total costs significantly. Keep in mind that if you pick a Medicare Advantage plan, you cannot buy a Medigap policy later to cover deductibles and copayments. Also, plan costs can change each year, so review your options during the open enrollment period from October 15th to December 7th. Comparing deductibles carefully helps you find a plan that balances cost and coverage, making sure you're prepared for your healthcare needs without surprises.